I've been thinking about something a lot lately. In sales, in business, in performance, we always talk about discipline, mindset, consistency. Work harder, stay focused, push through. But no one really talks about what's happening inside our body. How much of our performance is actually biology? Because the reality is, if your energy is off, if your hormones are off, your brain isn't functioning as its best. You can have all the discipline in the world and you're still operating below your potential. And I see this all the time. High performers pushing harder and harder when actually they're just exhausted, burnout, and not optimized. So it made me question, are we ignoring something fundamental? That's why I wanted to have this conversation with Dr. Marina Cordeiro. Not from a medical point of view, but from a lifestyle, performance, and longevity angle. Because if you're seriously about performing at the highest level, we can't just work on mindset. We need to understand our biology too. Dr. Marina Cordeiro, not only one of the most well-known, respected physicians now in the UAE when it comes to longevity, but a good friend of mine. In fact, my doctor as well. So I took this opportunity because I've been talking so much about longevity from a performance point of view, sales, how people get better, what consistency is about. But there is one number one factor, which is our bodies, right? And although we can talk about scripts and how to operate and methodology, especially right now where wellness and longevity is such a huge topic, that is more than important that I address to our audience what's going on in that field. So I want to start to dive into the super cool topics, and let's talk about peptides. Is it a hack, or do you really believe they are the future from a longevity point of view?
No, actually, peptides are amazing too when we do in the right way for the right person, the right time. Nowadays, peptides, they are actually, people are thinking peptides are like something magic, but actually no. It can cause a lot of side effects when we do the wrong dose, when we don't understand certain health markers, when we don't understand if there are contraindications for certain peptides, and there are contraindications, but can be amazing. Depending on the peptide, we can optimize not just the body composition, but we can optimize the health markers, we can optimize the brain performance of our patients, we can optimize the sleep quality. So yes, it's amazing therapy, but we need to do in the for the right person, the right time, with the right indication, and of course, keep tracking this patient.
So assuming that that person fits the profile and all the tests are good, if you had to pick your top three favorite peptides right now and the reason?
It's a difficult question. I love retratide because, of course, it's a GLP-1 and DIP, but it's glucagon as well. So it's actually decrease the visceral fat, the percentage of fat, but optimize the heart rate variability, optimize the lipid profile of our patients. And I love BPC. Actually, BPC changed my life, my gut health. And thymosin alpha 1, because most of my patients, they have autoimmune disease like Hashimoto. So yes, these three.
Those are the top three?
Yes.
Now, obviously, the peptide conversation it became very famous because of Ozempic was kind of the first diabetes-focused peptide to help people improve. And then we got Mounjaro, and now retatrutide seems to be the latest one. Now, this is all falls within the category of people looking to optimize weight. Now, from a brain performance perspective, is there any particular peptide that you feel it's the go-to if you want to get better on your day? Because again, in my world where we talk about sales performance, people need to be able to work long hours. So is there a particular one that you think it's the go-to
Actually, we can work with Selunk and optimize the sleep quality of our patient. Cortagen as well. We can work with cerebrolizine. We can work with Semax, like to increase the focus of our patients. And I love GISP, the delta sleep induced peptide, because most of my patients they have problems with the induction of the sleep, so it's so important for us to optimize this and indirectly this optimize the brain performance. Yes.
Now, when you talk about sleep, which is also a very important topic when it comes to performance, which is underrated, right? People feel sleep is not enough, especially in this part of the world. And we're having a conversation about this the other day. You say your patients don't sleep. People don't sleep in the UAE for some reason. So what kind of supplementation, assuming that person can take, you think is important if you want to optimize sleep?
Magnesium glycinate, of course, glycine. We can optimize with L-theanine, GABA, 5-ATP. So these are the most important supplements to optimize the structure of the sleep, of course. Yes.
And what happens with the brain? What happens with the person who do not maintain? I would say 7 hours should be your minimum, 8 ideally hours a day. So what happens if you stay so many days not having proper sleep?
The problem is not just about, like, let's say insomnia, when we don't active like enough hours to recover our brain. Some of my patients, they work with different time zones. This is another problem. And then we started to increase the oxidative stress of our brain. Nowadays, we can even measure this oxidative stress. And the problem is that we started to age faster. And what I work with my patients is to reverse this aging process and the aging process of the brain. Yes, and reducing the oxidative stress of the brain.
That's super interesting. We were talking also the other day about hormone replacement therapy. A big taboo when it comes to women. I think recently with the FDA changing that as something as a positive rather than you should be linked to cancer. And a lot of doctors have taken a view of not prescribing to women. But putting that aside is also an important tool for men, right? So right now, and when we were talking the other day, you were telling me that a lot of people are needing to have hormone replacement therapy much earlier in the age. Why is that?
Again, our environment plays a key role in this, let's say, this decline of our fertility. So males, they need actually early the hormone replacement, and females as well. We are seeing like the levels and the quality of the spermogram of our patients, like certain patients like young, 30 years old, and they already have like low levels of testosterone. The motility of the spermatozoids are not good. And come on, they are still young to have all these changes. Women with low levels of anti-Mullerian hormone, the ovarian reserve so low, and in a young age. So our environment plays a key role in this process. Of course, it's hard to control the toxins that we expose our body, okay? But then we need to manage as much as we can. Like, for example, I always ask my patients, try to eat like whole food, try to decrease the levels of processed food, try to focus on good quality of like meat, chicken, like the animal protein. But it's hard. Like our perfume has a lot of additives, hormone disruptors. So it's hard to avoid everything that can damage our hormones and decrease our levels of fertility.
So when you're talking about the environment that is causing people's health decline, so effectively, you're talking about diet. Then you're talking about EMF, which is the radiation aspect of, phones and connections. Then you have, what else would you include on that list of things?
The most important one, the air quality. Yes, this impact a lot our health.
And water as well, right?
Water as
You
well.
see in some countries as well, they have certain chemicals in the tap water where people drink, which has proven over time to cause harm.
Yes, true.
What would be your 3 most important hacks if somebody wants to get on the longevity train straight away?
Fix the foundation. Through diet, through our sleep, and movement. Yeah, this is the foundation of our health. Yes, these are the most important.
And if you want to give someone advice who's trying to take too many peptides and trying to take too many supplements at a time, what they should be aware? From your practice, what have you seen already?
There are contraindications. So
Right.
most important is to do with a professional who knows about the peptide, who knows about the indications and contraindications, a profession that can keep tracking you. And this is the most important.
Another fancy word in the longevity space is stem cells. Explain what it is, what it means, and practically, what do you do with it?
Actually, the most important is to understand who is the patient. Yes, the indications and the contraindications for the therapy. I have a lot of patients that they already done the therapy before, but without preparing the body to receive the cells. We need to prepare the body. So try to correct. Like, for example, recently we had a case of a patient who suffered from Parkinson. He came to do the therapy with us, and then we figured out that he is with diabetes. And I said to him, no, first we need to optimize the control of the sugar, optimize the insulin.
Metabolism, yeah.
The metabolism. Then later we'll do the therapy. Because when we will do the IV of stem cell, actually the stem cell will go to everywhere that need to be regenerated. And if we have a lot of inflamed areas, so then the area that I want to regenerate, yes, we'll lose the opportunity. And yes, it's an expensive therapy. So we need to optimize the patient for us to have a better result, the result that we want. I want most of these cells to go to the brain. So I need to optimize the whole body before. This is the most important. Of course, when we have a patient with osteoarthritis, so then I can inject directly into the joint. This is a different case. But then sometimes the better way is to do first the exosomes to decrease the inflammation, and then exosomes will prepare for us to do the stem cell. Yes.
Right now, everybody's running not to get old.
Yes.
What is your biggest concern from people's behavior when approaching longevity?
Nowadays, people, they want to do everything. And we need to understand what they truly need. This is the most important. And people think, but my friend, she's doing GHKCU. Can I do GHKCU? No, baby, it's not the right peptide for you. Like, for example, patients who suffer from allergy reactions, like that they have imbalance with histamine. It's not the right approach, this peptide. So then we can discuss another peptide. Then we can discuss the certain supplements to decrease to optimize the antioxidants and to reduce the oxidative stress. And then we can discuss stem cell. But even stem cell, the quantity we need to discuss each patient we need to personalize the strategy for the patient. Yes.
And I think my final question is if people are running a high performance environment from a business perspective, whether they are working long hours or they are in a sales career, do you think they can avoid burnout if they take care of their body in a different way?
Of course, of course. At our clinic, we measure the cortisol curve. We measure all the hormones of the adrenal. And then we can understand, because sometimes we already have like adrenal fatigue. So actually, I need to be more aggressive to support this adrenal. Then we have another patients that actually the cortisol is too high, or let's say the totally the opposite curve of the cortisol. So we have a strategy depend on this adrenal. Yes, but we have a lot of things to do.
Mariana, it was great to have you this conversation because it's important as well to bring awareness, because wellness and longevity is the go-to conversation right now, and I'm so glad that you explained a lot of things. I'm sure we'll have a second conversation soon, so thank you for coming.
Thanks so much.